Hi, everyone. Hoping that you all are doing well. This is Dr. Tracey McCarthy, psychologist, attorney, and educator, and we're going to be addressing a long overdue topic. We used to address SARS and COVID many years ago, but we haven't really addressed it in recent times. But now seems like a perfect time to address some issues. And so I have had some concerns for a while, and perhaps many of you have also had some concerns about the long range impact of SARS-CoV-2. Now, some of you might have even noted to yourself that many people seem different. I've heard this quite a bit where individuals will point out that they can't put their finger on it, but many people seem different after SARS-CoV-2. It's possible that part of this is coming from there being a little bit more to COVID than people might realize. Now, I know many people want to put it behind them. They don't want to think about it anymore. They don't want it brought into current conversations. However, this SARS-CoV-2 has essentially followed us into the present. And right now, we are dealing with the fallout from it. And from what I can surmise, we will be dealing with the fallout from it for the foreseeable future. Now, one thing that stands out about SARS-CoV-2 in current times is that artificial intelligence has actually served to highlight the current realities of COVID for many people, both young and old. And so what we are going to be addressing is not only how artificial intelligence has highlighted these current realities, but how artificial intelligence and SARS-CoV-2 met on a collision course, essentially. And so what I want you to do is, while we are having this discussion, I want you to think about questions that you have. You can share those questions, or if you have some thoughts or reflections, you can share those thoughts or reflections, and I will pause to give you a little bit of opportunity to do that. Because what I want you to do is to start thinking about not only addressing or understanding what is going on, and it's serious, but I want you to also start thinking about the implications and perhaps some prevention and intervention dynamics. Now, I'm going to be sharing with you some of my analyses of the situation, and I will be also referencing a number of sources. And so one source is coming from the International Journal of Infectious Diseases. Another source is coming from Diabetes and Metabolic Syndrome. Another source is Brain Behavior and Immunity. Another source is Brain, a Journal of Neurology. Now I'm going to be providing a list of these references at the end so that you can reference them yourself. So we're also going to be considering information from the Balkan Medical Journal, also from Natural Immunology, and another source is Brain Behavior and Immunity again, and Trends in Cardiovascular Medicine. So what we're going to be talking about essentially is the SARS-CoV-2 problem. We're going to be looking at disease dimensions related to SARS-CoV-2. These disease dimensions that have gone nowhere and have worsened over time for many people. We're also going to be looking at the dynamics related to the mind, and then how artificial intelligence fits into all of this, and then the multidisciplinary implications for the situations that we are dealing with as a society. It's very difficult to ascertain the extent to which other countries are actually dealing with these things the way that Americans are dealing with these things. And so, therefore, my focus primarily is going to be on what I can see here in the Americas. Now, you might recall that in January of 2020, the global public was generally unaware of the nature and potential of the severe acute respiratory syndrome coronavirus 2. Notably, the science communities, healthcare professionals, lawmakers, policymakers, global leaders, academic institutions, and business leaders have possessed only fragmented understandings of the nature of the virus and its components. Now, this piecemeal understanding has been undergirded by the very nomenclature of SARS-CoV-2. And we've talked about this nomenclature dynamic before. It's that naming of this thing. And so the naming of it is actually incorrect. It's possible that the naming was premature, but it's also possible that there was and continues to be a misunderstanding, again, of the nature of this particular microbe. And so, with respect to the erroneous nature of the name, we see that the name severe acute respiratory syndrome, that this label is inaccurate and therefore it's also misleading. And this serves to foster misunderstanding about the actual realities of this thing. Now, if you have any comments about what was just said, you can share those comments or those questions, and then we will collectively try to address everyone's thoughts and concerns, okay? So now I want to talk about the growing awareness. Now, both in the science community and lay communities around the world, people are finally coming to grips with the fact that the malady is not always symptomatically severe. Okay, and so in terms of nomenclature, we have it understood as severe. And so that's a misunderstanding. In fact, many carriers and spreaders of SARS-CoV-2 are found to be asymptomatic or low symptomatic. And for multiple reasons, asymptomatic and low symptomatic and immunocompromised carriage or carrying of this particular microbe, this creates a very unique contagion risk that undermines informed prevention and intervention efforts. Now, perhaps you've heard many people minimize SARS-CoV-2. There are people that will say things like, it's just a cold, or it's just like the flu. They didn't really have any problems. They were diagnosed with it, but they had no symptoms whatsoever. And so you hear people minimizing this microbe. And this has been to the detriment of everyone because this is not a play microbe. And so while you're thinking about this, I want you to take some time to think about the problem that might be associated with that very unique problem associated with a microbe, a disease state that has low or no symptoms. Symptoms are the things that the person is experiencing. And so this is the pathology that the person is experiencing. They might have a scratchy throat. They might feel tightness in their chest, in their lungs. They might have a loss of smell or taste. Those are the symptoms that they might be having. And oftentimes what we found is that individuals were diagnosed with COVID without having any symptoms. And that's odd just in itself. So for someone to have no symptoms whatsoever, that's problematic. And so basically all we have is a sign and that would be the testing. So we have a sign without symptoms. So I want you to think for a bit about what that means in terms of prevention and intervention efforts on an individual level and also on a collective level. Now, one of the other things to note is that this lack of consistent severity has also resulted in many people believing themselves to be virus-free when the opposite has been true. The reality that many of the initial symptoms are cold, flu, gastrointestinal, and allergy-like, that issue has fueled erroneous self-diagnosis, not just among the general public, but also among healthcare providers who were self-diagnosing. Now, one thing I want to point out is that there were some odd things going on with respect to the research early in this time period. And it appears that many researchers were stifled in terms of having their research published or taken seriously. And so therefore, as a lay public, we didn't always have ready access to all of the data. We didn't have ready access to all of the information. And in many instances, many researchers were not even pursuing answers to many questions. And so therefore, we weren't able to get answers to many questions. The research was very skewed. The research was, in that way, unethical because we were basically only getting research that was acceptable to whoever was determining acceptability at the time. And so what has happened is it looks like science has evolved, but we don't really know what the science was completely at the very beginning because there were many interesting assertions made about SARS-CoV-2 that have manifested in many ways. And so what we see now is that evolving science is recognizing that the problem of SARS-CoV-2 goes far beyond the acute to the chronic. And so now they're calling it long COVID. But that also is this misnomer. It is now well established that the virus adversely impacts the body beyond the respiratory system. Additionally, we now know that the virus is known to be a catalyst for not only that time-limited cold and flu-like syndrome, but for an often severe waxing and waning multi-systemic disease state. And so this is beyond people just having problems breathing or having cold and flu symptoms. What has happened is, or what has emerged in the science, is the realization that the symptoms that people are continuing to have and the signs that people are continuing to have are multi-systemic, meaning impacting the various systems throughout the body, not just the lungs. And so realizing the multidimensional nature of SARS-CoV-2, some researchers have referred to this thing as not simply a singular disease, but as a disease spectrum. So now, with respect to the spectrum dynamic, we have some individuals in terms of their symptoms that are on one end of the spectrum. And then we have individuals on the other end of the spectrum. And then we have individuals that are somewhere in the middle. Now, with respect to the people on one end of the spectrum, we have individuals that we just mentioned. They don't have any symptoms. Some individuals have minor symptoms. And then you have people in the middle that have significant symptoms, but not necessarily severe. And we're talking about those initial symptoms right now. And then we have individuals who the symptoms have been so severe that they have not survived. Okay, what this researcher, Barantes, uh, uncovered in researching post-mortem research was that SARS-CoV-2, the pathology associated with it, goes far beyond that initial pulmonary syndrome, and it includes prolonged bodily hyperinflammation. And so this isn't just a cold. Also, it has been noted that many people experience microhemorrhages from SARS-CoV-2 and thrombosis, and so clots. There are also people who have experienced erratic coagulation regulation in the body, and so it's not functioning normally. And so now we're talking about the vascular system. And so again, this is beyond the pulmonary manifestations that many people report initially. And so what has been found is with SARS-CoV-2, there are these other dynamics, these very serious dynamics are going on, and that this SARS-CoV-2 prefers certain organs in the body. It specifically attacks capillary-rich bodily organs such as the lungs, the brain, the kidneys, and the gastrointestinal tract. And so you might want to take a moment right now and stop the conversation, or you can continue on with this conversation. But you might want to take some time now to reflect on what has just been said and think about whether you have some questions related to that, or whether you've seen manifestations related to that. Have you seen people or known of people who have had symptoms that have gone far beyond these pulmonary symptoms that were initially reported? Now, looking at additional disease dimensions, there are also neurological issues and concerns. And so this same researcher looking at these post-mortem studies found that there were issues related to neurological functioning. And so what has been noted is that individuals who've been exposed to SARS-CoV-2 have also had what would be considered psychological challenges, neuropsychological challenges, and neuropsychiatric challenges. And so many people have experienced, subsequent to SARS-CoV-2, things like memory loss, confusion, altered consciousness, post-traumatic stress disorder, Parkinson-like symptoms, Alzheimer-like symptoms, cerebrovascular disease. Now, we also have other researchers that have noted that coronavirus directly or indirectly adversely impacts the respiratory system, the cardiovascular system, the lymphatic system, the digestive system, the urinary system, the muscular system, the skeletal system, the endocrine system, the reproductive system, and the nervous system. Now, professionally, one of the things that stands out to me relates to the nervous system. And so while all of the bodily systems are important, the nervous system serves as the mastermind for the entire body. And for this reason, the nervous system and the cardiovascular system morbidities growing out of SARS-CoV-2 contact demand heightened scientific, health, academic, and community attention. Such also demands attention from individuals and families. It has also been noted that the integumentary system has been impacted by contact with SARS-CoV-2. And so with respect to that, we are talking about the skin, so that connective tissue. And so, of course, this aligns with some of the dynamics that speak to this autoimmune dynamic related to SARS-CoV-2. What's also noteworthy about this entire dynamic is that at this point, it appears, based upon the manifestations that have been seen, it appears that many of these multi-systemic dynamics have the potential to be lifelong. And so that's not only lifelong with respect to the elderly or adults, it's possible that children and adolescents later on in life might start to manifest these multi-systemic symptoms. Now, we're going to be talking specifically about the nervous system and the brain. But before we go into that, I just want to point out that the emerging science is also revealing that SARS-CoV-2 is highly vascular in its impact. In other words, it is severely impacting the vascular system, the cardiovascular system. And it has been specifically implicated in multi-systemic dysfunction. And so when you hear about children and adults with these sudden multi-systemic dysfunctions related to SARS-CoV-2, what you see is that this is not only just a growing concern, but it's almost becoming a growing norm. Many researchers have also noted that SARS-CoV-2 is associated with damage to the blood vessels and the lymph vessels. Hence, the heart is significantly impacted. And so, just like the neurological system, the cardiovascular system is vital. And so, the entire body is impacted by the health or the illness of the cardiovascular system. Now back to the matters of the mind related to SARS-CoV-2. Now, in relation to the vascular dynamics, we also see that for some strange reason, SARS-CoV-2 has a high affinity for the nervous system. It likes the nervous system. It is drawn to the nervous system. It likes to attack the nervous system, and specifically the brain. And so, as many people are now becoming aware, catching, with quotation marks there, catching SARS-CoV-2 goes beyond catching a respiratory irritant to potentially catching a debilitating, life-threatening cardiovascular system disease or nervous system or brain disease. Researchers Harrison and Tackett in 2023 also noted that there is an increased risk of neuropsychiatric and neuropsychological symptomatology subsequent to people being infected with SARS-CoV-2. This includes cognitive impairments such as cognitive processing problems, People are having brain fog. People are having memory difficulties related to exposure to SARS-CoV-2. Additionally, what has been noted in terms of psychology is that many individuals subsequent to this exposure to SARS-CoV-2, they developed symptoms of anxiety, depression, and psychosis. Now, of course, many people are not on the lookout for SARS-CoV-2 being related to the development of anxiety, depression, or psychosis, or any of these brain dynamics that we've been talking about. However, what they are starting to see is that there are these correlations with people manifesting these symptoms subsequent to exposure to SARS-CoV-2. Now, when many healthcare practitioners see this dynamic taking place, they are often attributing this to what they are calling a long COVID manifestation. However, just like the original nomenclature, we have another diagnostically misleading naming of a situation in terms of this diagnosis, because these things are not something called long COVID. People might be calling it that, but that's not what it is. It's not chronic COVID. It's because SARS-CoV-2 has shown itself to be the instigator of a chronic condition that involves autoimmunity and T cell mediation. And so when looking at the way that SARS-CoV-2 impacts the body, it impacts the body in ways that are similar to lupus and HIV. So this comparison that has been made by researchers such as Moss in 2022, they have noted this multi-systemic autoimmunity dynamic. This comparison hints at long COVID symptoms actually being likely main effects of SARS-CoV-2 exposure versus some rare latent sequela of such. And so, getting back to the focus on the brain, notably, some researchers have observed that the nervous system is extremely vulnerable to SARS-CoV-2 for a number of reasons. Now, some of these reasons are structural, the way the body is made, and the access that the virus has to the brain. Now, some of the pathologies that have been noted related to the nervous system and the brain relate to the brain's anatomy and the brain's physiology. And so what we're talking about is this virus impacting the actual structure, the anatomy, the structure of the brain, the components of the brain, and causing injury to the actual structure of the brain, but also impacting the physiology of the brain. And so the way that the brain operates and all of the things that are in the brain, how those things are operating. And so then you start to think again about that vascular system. Now, what has been observed is perhaps this dynamic wherein the olfactory nerves are supporting neuroinvasiveness. And so the olfactory nerves may be serving to facilitate SARS-CoV-2 impacting, infecting the brain, or creating injury in relation to the brain. Also, with respect to the olfactory nerves, these components might actually be facilitating the rapid spread to various brain structures. And so if you think about the olfactory nerve and you even think about how they were testing for SARS-CoV-2, you can see that there is the belief that this is a ready pathway to get to these various brain structures. And so some of the brain structures of concern in terms of viral impact include the thalamus, the brainstem, the temporal lobe, the amygdala, the limbic lobe, and the insula. Now, this is significant again because the brain is the mastermind for the entire body. And so when you have something that is causing damage, a virus that is actually causing damage in one way or another, directly or indirectly, to components of the brain, we have a significant issue because, again, these different components of the brain impact and control various functions throughout the body. And so, due to the nature of these symptoms, clinical psychologists are among the healthcare practitioners that are potentially on the diagnostic front lines, but they have to be aware of the fact that there are these brain implications for SARS-CoV-2 exposure, and there has not been significant general conversation about this dynamic. And so essentially, many people are believing or led to believe that these brain related symptoms are just popping up. They are not being helped to see that there's possibly a connection between a prior infection related to SARS-CoV-2 and their neurological symptoms. And so therefore, individuals might not be thinking about this correlation and what they should do in relation to this potential correlation. Because if there is a viral catalyst for these symptoms that many people are experiencing, then one would need to address the viral component to this entire dynamic. And again, if psychologists and psychiatrists are not aware of this, they might be simply trying to treat some symptoms without getting to the actual cause of the symptoms. And so there might be temporary symptom relief, but if this viral impact continues, there will not be long-term relief. And there may be some confusion for the individual experiencing it and for the clinician. There might be some confusion about why symptoms might not be resolving when using certain interventions. And so this needs to be made clear for clinicians and for patients or clients. So now here we have multiple people with symptoms of brain fog. People have confusion. There are various cognitive impairments that have been noted subsequent to SARS-CoV-2 emerging on the world stage. And then, interestingly, 2 years into the SARS-CoV-2 situation, we have this releasing of this thing known as artificial intelligence on a large scale. And so it's accessible to many people. And there has not been a discussion, at least that I could find, that is tying these things together. And so we have this artificial intelligence that, again, popped on the world stage during this pandemic. Okay. And it is basically being hailed as some sort of new messiah. I've noted that many people have all sorts of messiahs popping up. Okay, so artificial intelligence for many people is like a messiah to them. And its use has rapidly expanded in governmental settings, academic settings, healthcare settings, and other professional settings. Use of artificial intelligence, while a growing convenience for many, has emerged in a time that, interestingly, cognitive and overall functioning for many people might be increasingly impaired. And we're talking about impairment for both young people and old people. And as one might imagine, if something like artificial intelligence presents itself to many people who are having cognitive difficulties, who might not even realize they are having cognitive difficulties, this artificial intelligence might present itself as sort of a super messiah for many individuals. And you see this perhaps in business settings, in academic settings, whether we're talking about higher education or elementary education, secondary education. There may be this experience of artificial intelligence being the cure for whatever is ailing people in terms of cognitive dynamics. Now, one of the concerns that I have is that artificial intelligence usage and overusage can serve as a crutch. These two things can serve as crutches that mask many cognitive symptoms, affective symptoms, emotional symptoms, attitudinal symptoms, and behavioral signs and symptoms that might otherwise be timely noted and alleviated or mitigated. But what has happened is that artificial intelligence is becoming the norm. And so therefore, individuals may be able to what we call fly under the radar without people readily knowing, either individually or collectively, without people readily knowing that there is a problem. And so also specifically, dependence on artificial intelligence can serve to exacerbate cognitive impairment and decline that might have initially been brought on by SARS-CoV-2. And so individuals may be experiencing these cognitive difficulties, these emotional difficulties, these behavioral difficulties, and not understand why. But then the artificial intelligence might serve again as this crutch that then makes the cognitive impairment worse as the people depend on the artificial intelligence without fully understanding why they are having or why they are potentially having the difficulties in the first place. And for many reasons, it's really easy right now to sell people on the need for artificial intelligence, the benefit of artificial intelligence. If people are struggling, then they might be more inclined to believe that they need to lean on artificial intelligence. And because artificial intelligence met with these cognitive impairments, these neurological impairments, these cardiovascular impairments that have been SARS-CoV-2, many people believe that they need the artificial intelligence in order to function in many arenas, whether we're talking about professionally or whether we're talking about academically. You even have some people leaning on artificial intelligence for their social relationships. artificial intelligence writing their emails, artificial intelligence writing their text messages, artificial intelligence basically doing the thinking and the feeling for people. And no one is really stepping back asking why people are so dependent on artificial intelligence in such a short period of time. Now, some people might think that people are just lazy or it's just convenient, but I'm offering to you that there might be something more actually going on. Now, just this year, there were some researchers that started looking into what they've coined the accumulation of cognitive debt related to artificial intelligence usage. And what they found was that those who use these, what are called large language models for essay writing, these individuals actually experienced reduced brain wave activity. They experienced lower activity engagement, and so they weren't as engaged. And they had a lower sense of work product ownership. And so they didn't really have a sense of ownership for the product that they ultimately created or the work that they turned in. Okay. And so when we're looking back at the whole dynamic of SARS-CoV-2 impacting the brain and brain wave activity, we can see how artificial intelligence may actually serve to make the impact of COVID or SARS-CoV-2 worse. It can be made worse cognitively, emotionally, and behaviorally. What the researchers also indicated was that these large language models provided immediate gratification and convenience, but at a high cost. And so, what is that cost, you might ask? What they found was that over the span of 120 days, those who use these large language models with this essay writing dynamic, they exhibited deficits at multiple levels. So just imagine that. People are using the artificial intelligence. They are saying it makes them more effective. They're saying that it helps them with their research. It helps them with their writing. But what was noted was that there was neural underperformance. And so the neurological system was underperforming. There was linguistic loss, language loss, and behavioral struggle. And so all of that taken together indicates that there is a need to mitigate the educational consequences of this artificial intelligence, the psychological consequences, the social consequences, and the professional consequences. And this needs to be a long-term examination in terms of mitigation. Again, I understand that many people want to put SARS-CoV-2 behind them. However, it doesn't appear to be going anywhere anytime soon. People are still coming down with the symptoms of SARS-CoV-2. People are still suffering from SARS-CoV-2, chronic SARS-CoV-2. And so we need more research, not less, so that we can better understand the nature of these large language models that people are using and the holistic human and social cost of this usage over time. It is clearly convenient for many people, but it is coming with a large cost. And some of these costs are related to various professions, because you have many of these professions now leaning on artificial intelligence versus authentic individual intelligence. And we are seeing this in notably healthcare. And you can imagine how problematic this might be. We also see it in professions such as law. We see it in various professions where individuals are escalating in terms of their use of artificial intelligence, and there is very little consideration given to the cost of this particular benefit. And so here we have these growing cognitive impairments, but also growing use of artificial intelligence. And this growing use includes healthcare settings. And so there are all sorts of potential practical and ethical pitfalls for this increasing use of or dependence on artificial intelligence in the health sciences. For one of the main concerns is that there understandably would be, it's likely, it's hard to imagine it wouldn't happen, there would be knowledge and skill erosion over time. So if people are not having to think and people are not having to do or develop certain skills, then the knowledge and the skills, if you don't use it, you lose it, um, would erode over time. And so that over dependence on artificial intelligence can be detrimental for the individual practitioners and most definitely for those who are seeking health care. And so this might also in turn lead to a pervasive lowered public confidence in the knowledge and the abilities of these doctoral level folks and other professionals and related paraprofessionals. And so if everyone's using artificial intelligence to do the work that doctors did, to do the work that the nurses did, to do the work that the med techs did, if everybody's leaning on artificial intelligence to do the work, then the public will have lower confidence in the abilities of the actual professionals. And so getting back to this relationship to SARS-CoV-2, while artificial intelligence may be burgeoning and is presented now as sort of this technological medicine or panacea, it is also in many ways undermining the actual diagnosis of these problems associated with SARS-CoV-2. And it might be preventing many people from having an earlier identification of a problem and perhaps identifying something that would mitigate it or cure it. And now might be another good time to sort of stop and think and reflect on what we've been talking about here. One of the things that we need to be mindful of is that there needs to be a multidisciplinary effort in relation to understanding SARS-CoV-2 and its impact, its holistic impact, because it is impacting so many things. It has gone nowhere, as I've already mentioned. And so we need to be figuring out collectively what we are going to collectively do about it and the problems that have come with it. And so for many reasons, there needs to be multidisciplinary research on the impact of SARS-CoV-2 on the various systems in the body and specifically the nervous system. And it's also equally imperative that existing multidisciplinary research that has already been done, that research be studied to come to a more comprehensive understanding of the nervous system damage that has been wrought by SARS-CoV-2 on the human population, and namely in the United States. And of course, this would also take significant consideration of the adverse impact on the cardiovascular system. Now, this might be a lot to take in right now, particularly for those who were not aware of this multi-systemic impact of SARS-CoV-2, and also of the collision course related to artificial intelligence and SARS-CoV-2. And so where you have the decline of human functioning, you have this escalation of this artificial intelligence functioning, and many people not seeing the connection between these two dynamics. But these are things that we definitely need to consider. We need to consider them individually, and we also need to consider them collectively. Remember, knowledge is power. Take care.